Hello, can somebody confirm you can hear me? Oops, that's the wrong one.
We can hear you.
We can hear you.
Great. All right, before we begin, are there any questions? Today is February 6th, and we are supposed to be covering Lab 6 on disc diffusion and antibiotics. Any questions about any of that? All right, before I get going, let me state that I forgot to mention something in our last lab about the unknown project. Let me go to the Canvas unknown project. Oops, wrong one. When you're requesting a test, please put it in the bottom of your unknown notes. So you need to do that. Request a test by putting it in your unknown notes. So click here. And then you'll have a link for uploading. I've got a link for the script speed grader for each student. So click there, and then in the bottom of your unknown notes, put your test request. Do not put the test request in the middle of the notes. If you put it at the top of your notes, I will find it, but I'm asking you to put it at the bottom of your unknown notes, because when I look in the unknown notes, which I will do at least every other day, except for maybe Saturday and Sunday, I will look in each student's unknown notes looking at the bottom, like somebody's got something here. So I'll look at the bottom here to see if there's a test request. And then I'll just go to the next student looking at the bottom. Now, if it's at the very top of your unknown notes, I will find it. Oh, come on. Gotta get that up. There we go. But if it's in the middle of your unknown notes, I will not find it until I read your unknown notes. I will eventually read your unknown notes, but I'm not going to read them every time I come into the unknown notes, meaning I will go through at least every other day looking for if there's a test request. And all I'm going to do is look for the test request. And if you have it in the middle of your unknown notes, I won't find it until I read your unknown notes. And I will not read your unknown notes at least every other day. Okay, I'm not sure how often I'll read the unknown notes, but um, so put your test request at the bottom of your unknown notes page, and then I'll easily find it. Any question about any of that? Oh, if you put a test request in your email, I'm not going to honor it because I want all the information for the unknown project in your unknown notes pages. That way you will have an easy time of finding it, and I will have an easy time of finding it. And so I'm not going to honor any test request if it's sent in an email. And then let me state that in the grading, I did mention this, that you will be graded on, oh, let's go down here and just come down here. Following the rubric on the grading, and you'll be graded on these points. Um, on this one where it says your utilization of resources, was excess media used or irrelevant test performed? I discussed this before, but I forgot to mention that when you're all done and you think you have your unknown bacteria identified, you are allowed to request one confirmation test. So if you only have one extra test, everything is good. You will have no excess media used. However, if you were to request two uh, tests after you've already identified it, that would be one excess media being used. Any question about that? Meaning you can get one confirmation test and it doesn't count as an excess. You do not need to do a confirmation test, meaning if you think you've identified it, you can stop right there. But if you want, you can do one confirmation test. A confirmation test is just a test to confirm you have the bacteria that you think you did. So you're running another test. All right. Any question about any of that? No, let's go back to the syllabus. And we're going to be doing Lab 6, Disc Diffusion and Antibiotics. There is some reading for Lab 6, Disc Diffusion, Evaluation of Disinfectants and Antiseptics and Antibiotic Effectiveness. You need to read page 177 on the terminology of uh, biological control. Read about the principles of effective disinfection, evaluation, and disinfectant and different types, page 187 to 194. Read about the chemical methods of microbial control, page 196 and 197, so about a page. And read about antibacterial drugs, meaning antibiotics. That's also only a page, 154 to 155. And look at table 20.3. And then read about the tests to guide chemotherapy, the diffusion method, and that's page 150, page 567 to 569. There are some video clips we're going to be working with in this lab, and we have a virtual lab in this lab. Any question about any of that? All right, your learning objectives for this lab is one, identify the types of chemical agents and the active ingredient used in the various disinfectants and antiseptics. Two, evaluate the effectiveness of disinfectants and or antiseptics using the disc diffusion method. When they say disc diffusion method, they're referring to the Kirby-Bayer disc diffusion method. Three, determine the mode of action of various antibiotics. Four, evaluate the effectiveness of various antibiotics using the disc diffusion method. Five, list variables that influence antibiotic disc diffusion susceptibility testing. That, once again, is the Kirby-Bayer disc diffusion method. And then six, be able to define the terms. What's sterilization, disinfection, what's a disinfectant, what's an antiseptic, what's a bactericidal agent, what's a bacteriostatic agent, what's an antibiotic, what's the spread plate method, and what is a zone of inhibition. Any question about any of that? All right, evaluation of disinfectants and antiseptics. Sterilization will eliminate all viable organisms, including endospores that may be present. Disinfection refers to the destruction of vegetative cells, but not necessarily endospores. So when we disinfect our toilet, for example, we destroy all vegetative cells, but we do not necessarily kill all endospores. Any question about any of that? A disinfectant is a chemical agent applied to an inanimate object So when we're disinfecting our toilet, we're going to do that with a disinfectant. An antiseptic is a chemical agent applied to living tissue. So if we apply something to skin to clean it, we're using a chemical antiseptic. And that doesn't matter if it's the same thing. Like if you use bleach on your toilet, it's a disinfectant. But if you use bleach on living tissue, it's an antiseptic. Usually antiseptics are less harsh, um, and maybe not as effective as a disinfectant, because you're applying it to living tissue. Any question about any of that? And obviously, bleach would be the same, but usually an antiseptic is less caustic and less harsh on the skin than bleach is. And something like tincture of iodine would be a good antiseptic to apply to living tissue because it doesn't damage the living tissue, but it does. Um, it's a real good antiseptic, killing a lot of vegetative cells, not necessarily endospores. Let me put that at the bottom here. So to evaluate the effectiveness of chemical agents, the surface of a nutrient agar plate is inoculated with a particular bacterium. Paper disc saturated with a different chemical agent is then applied to the surface of the agar. The chemical agent will diffuse out of the disc and into the agar, establishing a concentration gradient around the disc. You then incubate the plate overnight at 35 degrees, and then the bacterial growth pattern around the disc is observed. If there is a zone of inhibition, an area around the disc having no bacterial growth, then the chemical agent is assumed to be effective for that particular bacterium. Conversely, if there's no zone of inhibition, the chemical is assumed to be ineffective. Any question about any of that? Now, that doesn't mean that the chemical is uh, sensitive or resistant. We have a special definition for those words. But if you see a zone of inhibition, you know that the chemical agent can kill or prevent the growth of bacteria within the zone of inhibition. So it's effective at least in the zone of inhibition. And if there is none, then it's not effective. Table 6.1 is showing you some common disinfectants and antiseptics, telling you the category name, what's an alcohol, what are aldehydes, what are halogens, and then the general action and the preferred use. Like alcohols are a very weak antiseptic agent, and we call that a degerming agent because it's not really a disinfectant or an antiseptic because it's not a very good one. We can use it as an antiseptic, but when you apply alcohol to the skin, you do not remove all of the vegetative cells in the region that has been alcoholed. You just lower the numbers to safe numbers so that when you then give a needle shot in that area you swabbed with alcohol, you've degermed the area, reduced it to low numbers, so it's now safe to give the needle shot. But it is not really, I don't know, clean very well. You wouldn't want to do surgery in that region, for example. You'd want to use a stronger antiseptic. Uh, Aldehydes are frequently used as disinfectants, and they are one of the few disinfectants that actually kills endospores. Generally, most disinfectants do not kill endospores. There are a few, like peroxygens, like hydrogen peroxide, can kill endospores. And then aldehydes can kill endospores. Halogens, like chlorine bleach, It's a very good disinfectant, but it does not kill all endospores. Depending on the species, some species and some species of endospores can survive treatment with bleach, and others cannot. So, like I said, it depends on the species. Heavy metals is actually used most of the time as a weak antiseptic or disinfectants. Um, for a while there, we stopped using them, at least the medical community, because better agents came out. But because of the resistance to bacterial agents to the treatments, like antiseptics, the use of heavy metals has come back because we can use heavy metals and it doesn't tend to create antibiotic resistance. Peroxygens, like hydrogen peroxide, is actually a very good antiseptic treatment because it can kill um, endospores. Phenolics, chemicals like phenols, usually used as a disinfectant, but it can be used as an antiseptic in low concentrations. Surface active agents are disinfectants. Actually, soap and detergents are a surface active agent, and there are new ones like quaternary ammonium compounds, which are used more in the hospital, and they're very good disinfectants. The zone of inhibition size depends only partially upon the sensitivity of the organism to the disinfectant and or the antiseptic. There are various other factors that affect how large that zone of inhibition is. So the zone size includes the concentration of the chemical. Generally, more concentrated chemical, the larger the zone of inhibition. It also depends on the molecular weight of the agent. The smaller the molecular weight of the agent, the greater the zone of inhibition. And also on the density of the bacterial inoculum, the higher the bacteria, meaning the more dense the bacteria, generally the smaller the zone of inhibition. So realize there are different factors that do affect the zone of inhibition besides the sensitivity of the organism to the disinfectant. So when we evaluate antibiotic effectiveness, antibiotics are categorized as bactericidal if they kill the bacteria. They're classified as bacteriostatic if they only inhibit the growth of the bacteria. Any question about any of that? When you look at a zone of inhibition around a paper disc having antibacterial agents in it, or it could be antibiotics in it, we do not know from the zone of inhibition if they are bactericidal or they are bacteriostatic. And you'd have to go and actually take a look. The only one I know off the top of my head is penicillin G, and the other members of the penicillin family tend to be in the zone of inhibition, tend to be bactericidal, but it is true the edge of the zone of inhibition could be only inhibiting the growth, meaning the very edge of the zone of inhibition could be bacteriostatic, but the rest of that zone of inhibition, meaning most of the end zone of inhibition, will be bactericidal. Okay, and that's the only one I know off the top of my head. In fact, I do not know an antibiotic which is bacteriostatic, although most of them, like most of the ones that inhibit protein synthesis, are bactericidal. So I think most of the antibiotics are bactericidal, but there are a few which are bacteriostatic, and I just don't know off the top of my head what they are. And then there are probably others like penicillin G or the members of the penicillin family, where it depends where you are in the zone of inhibition, because most of the zone of inhibition will be bactericidal, but the very edge of the zone of inhibition could be bacteriostatic, meaning only inhibiting the growth at the edge of the zone of inhibition. When you have a bacteriostatic antibiotic that's being used, we are relying, or meaning the health profession is relying on the immune system to assist in the elimination of the infection because the antibiotics do not kill off um, the organisms. They only prevent it from growing. And then the host immune system will generally remove the bacteria from the host. So what do you do with the patient who has AIDS? Obviously, you would not want to use a bacteriostatic antibiotic. You'd have to use a bactericidal one. All right. The Kirby-Bayer disk diffusion test is the most common method used for antibiotic testing. The results of such testing help physicians in choosing which antibiotic to use when treating a sick patient with some antibiotic. Bacteria are isolated and then swabbed on a agar plate so that the bacteria are everywhere, and then paper discs impregnated with an antibiotic are added to the surface of the agar. This will establish a concentration gradient around the disc, and then you incubate the plate, look at the plate, and look for, scroll down a little bit, look for zones of inhibition around the disc. You can have large zones of inhibition like that one, or smaller zones of inhibition like that one. And then areas with no zone of inhibition, like pretty much that one, pretty much that one. That one has a very slight zone of inhibition. Um, if there's no zone of inhibition around the disc, you can assume that the bacteria is resistant to that antibiotic. However, if there's a small zone of inhibition versus a larger zone of inhibition, you cannot state for sure whether the antibiotic is resistant or not, because to be resistant, you got to take a look at the diameter, the size of the zone of inhibition, and then compare it to a table. Shrink that down now. Compare it to a table made by the NCCLS, National something something LS Standards. S stands for standards. I don't remember what NCCLS stands for. National Chemical, something like that. I'll get it in a minute. Uh, Anyways, on this table for the antibiotic penicillin, and they have the table set up for each antibiotic, and this would be penicillin G. Uh, you then measure the diameter of the zone of inhibition, compare it to the table. If the for penicillin, if the zone of inhibition, the diameter is less than or equal to 20 millimeters, then we say that the bacteria are resistant for the antibiotic. And the table will be set up for each species of bacteria. For Staphylococcus aureus, if it's less than 20 millimeters or equal to 20 millimeters. For penicillin G, we say that that is resistant to penicillin G. If, on the other hand, it is greater than or equal to 29 millimeters, the zone of inhibition, we say that the bacteria are sensitive to penicillin G. And in between that size, meaning the zone of inhibition is between 21 to 28 millimeters, then we say it's intermediate. Any question about any of that? Each antibiotic in each species will have a different standards in the table. So the table has a large number of species, a large number of antibiotics. And that's how we define something that's sensitive and resistant to the antibiotic. Any question about any of that? All right. The inhibition size, the zone size, I've already told you, is dependent on several factors. First, it is dependent on the sensitivity of the bacteria to that antibiotic. So if you see a larger one compared to a smaller one, it's probably true that this species of bacteria is more sensitive to this antibiotic than that one. But there are other factors that play a role in the size of the zone of inhibition. It does depend also, besides on the sensitivity of the bacteria to that antibiotic, it does depend on the diffusion rate of the antibiotic. Generally, a larger molecular weight antibiotic will have a smaller zone of inhibition than a smaller uh, molecular weight antibiotic because a smaller antibiotic has an easier time diffusing in the agar. The degree, it also will depend on the growth rate of the bacterium. Generally speaking, a bacteria that grows slower, is that right? I think if the bacteria grows slower, it will have a smaller zone of inhibition than a bacteria that grows faster. It also depends on the amount of density of the bacteria cells you put on the plate. The more dense the bacteria, the smaller the zone of inhibition. So table 6.2 looks at all the standard protocols we use for doing the Kirby-Bauer procedure so that when we get a zone of inhibition, we know it's mostly due to the sensitivity of the bacteria to that antibiotic. So when you do the Kirby-Bauer procedure, you always inoculate from nutrient broth using several bacteria colonies grown on non-selective media, and the colonies are no more than 24 hours old. You then grow the broth to the turbidity of being 0.5 McFarland standard units, and if it's not that, you just dilute it so that there are approximately 10 to the fifth organisms per mil, meaning 0.5 McFarland units have the density of bacteria about 1 times 10 to the fifth organisms per mil. You then inoculate the bacteria at room temperature onto a Mueller-Hinton agar plate. And different agars will have a different size of zone of inhibition. So we always use Mueller-Hinton agar plates with a pH between 7.2 and 7.4. Furthermore, the agar in the plate is always at a depth of 4 millimeters because the depth of the agar will affect the zone of inhibition because the deeper the auger, the less the antibiotic will diffuse out of the disc. And then we always do it on a plate that's 150 millimeters in size and diameter. And that's just to standardize it, same as we're sort of doing with Mueller-Hinton auger plates. And you always use a meaning a sterile, non-toxic swab to spread the bacteria over the plate to obtain confluent growth, meaning the bacteria should grow everywhere except maybe where there's a zone of inhibition from the antibiotics. And then after the bacteria are put on the plate, you let it usually sit for 5 minutes and then place the disc at least 24 millimeters apart on the plate, no more than 12 discs per the 150 millimeter plate. And you add the antibiotic disc between 5 minutes, but no longer than 15 minutes after you've inoculated the agar with the bacteria. You allow the bacteria to sit for 5 minutes so that the liquid that you put on will be absorbed into the agar plate. And then you put the disc on before 15 minutes so that you don't allow you don't allow the bacteria essentially to get growing before you put on the paper disc. You then incubate the plates in a non-CO2 incubator between 16 and 18 hours at 35 degrees, and you put the plates in the incubator no longer than 15 minutes after you add the antibiotic disc. Once again, it's just to standardize so that we don't have an effect on the zone of inhibition from when you put on the antibiotic disc. The same with the CO2 incubator. And then obviously the size of the zone of inhibition can be determined by how long you've grown the disc. So we always do it between 16 and 18 hours, as well as the temperature is always at 35 degrees C, which can also affect the zone of inhibition. And then after incubation, the inhibition zone size are measured using their diameter, using millimeters. That's recorded, and then you look up the NCCLS table, and that's what the NCCLS table stands for. The National Committee for Clinical Laboratory Studies is the name of that table. The bacteria is considered to be sensitive if the bacteria zone of inhibition is greater than a certain size in the table, and it's considered to be resistant if it's smaller than a certain size labeled in the table. And in between, it's considered intermediate. And I've already shown you for Staphylococcus aureus in the table for penicillin G, if the diameter is less than or equal to 20 millimeters, we say it's resistant to the penicillin G. And if Staphylococcus aureus has a diameter greater than or equal to 29 millimeters to penicillin G, then we say it is sensitive to penicillin G. Somewhere in between, we say it is intermediate. Any questions about this lab? All right. So those are the terms we discussed in these lab. Know those terms. You don't need to look at the references, but there they are. You're not going to be physically performing any of these activities, but you will be held responsible for how to interpret the effectiveness of antibiotics using the Kirby-Bauer disc diffusion method. Let me get something out here. So watch the video for preparing a spread plate, and then review the steps for aseptic technique for preparing the bacterial lawn, meaning how you set up the Kirby-Bauer test. First, get a sterile cotton swab. Pretend this is cotton swab. Dip it into your mixture of bacteria. Remove the worst of the liquid on the side of the tube. Hopefully you can see this. It looks like you can. So um, swab it. Let me go ahead and stop the share for this so you see it better. Swab it everywhere. Pretend this is a disc. Everywhere on the disc. So that you have growth of the bacteria growing everywhere. When you're done, rotate the swab a quarter of a turn. I don't know if you can see that. Rotate the disc a quarter of a turn. Swab it one more time. Going everywhere. Then when you're done, rotate the swab a quarter of a turn, rotate the disc another quarter of a turn, and do it at least 3 times, swabbing everywhere. Sometimes the procedure tells you to do it 4 times. Okay. And then when you're all done, take your swab and go around the edge of the disc so that you'll get bacteria growing along the edge. Why you do it along the edge is usually when you're swabbing, you might not swab all the way to the very edge. So you go around putting the bacteria on the edge of the plate. And now you should get a lawn of bacteria growth where the growth will grow everywhere. We call it a lawn because in a lawn, we have green grass everywhere on the lawn. Any question about any of that? Share my screen now. Then you let the, I'm having trouble getting hold of my mouse. There it is. Cotton top swab goes in the biocide container. Um, and so there we do it 3 times. Let the plate sit for 5 minutes and then put on the discs, having the antibiotics in them, making sure the discs are 20 millimeters away from each other. And we actually have a tool to do that. That's how they got this, where all the discs are at least 20 millimeters apart and they're evenly spaced and all that. We have a tool for doing that. And like I said, the disc should go on between 5 minutes after you put the bacteria cell on the plate, and then before 15 minutes after you put the bacteria on the plate. And then you let the plate sit for a little bit and then put it in the incubator no longer than 15 minutes after you put the antibiotic disc on the plate. Usually we put the disc in the incubator upside down. Remember, we always put things in upside down so that there won't be a drop forming on the lid and then spilling down into the disc and ruining the bacteria growing on the disc. Doesn't necessarily contaminate it, but it would destroy the zones of inhibition. Any question about any of that? There is a question 3 here. I don't think I have that in the worksheet, but you should try and answer it for your own benefit. Let me go to the worksheet here. Yeah, I don't have that in the worksheet, so you don't need to answer that question, but you should do that. And then you should view the video for how to prepare the Kirby bar disk diffusion method. Interpretation, a video on the interpretation of the results for the Kirby bar disk diffusion method. And then we have a virtual lab. Click on that. Come on, open the hyperlink. This might take a little while to download, especially if you have a slow internet connection. I have a fairly fast internet connection, so it comes pretty quickly. Let me put that over here and then start. And there we're looking at the Kirby bar disk diffusion task. And you can see we've got bacteria growing on the plate. And we got antibiotic put on the plate. And we incubated this plate overnight at 35 degrees. And now you come out here and observe and measure the sizes of the zone of inhibition. How you actually do this is you grab the ruler and take it up to the paper disc. Obviously, that one has no zone of inhibition, E here. E stands for erythromycin right there. And then there's S for probably streptomycin right there. So let's go ahead and do that one. So the diameter here is about, I would say about 18 millimeters. And we come on here and we select this one. If you get the right answer, it'll show green. If you select the wrong answer, you get a red X. Okay. So let's go ahead and do it one more time. I'm going to do a purposely the wrong one, TE. It looks like it's about 17, 18 also. So let's take the wrong answer. So the right answer here will be there. 15 to, it's like I said, 17 is what I guessed there. How you use this is that's the first one, E. coli, with the different antibiotics. Click the menu, hit restart, you come up with Pseudomonas aeruginosa. And here's the zone of inhibition right there. That's a real big one. Something like 40 millimeters. Oh, right there, obviously sensitive. And then where's the small one? Something like there. So you measure it. And then to get the third one, click the menu again, hit restart, and there's our third plate. Staphylococcus aureus, and it looks like only vancomycin has a zone of inhibition. All the others are sensitive to that, uh, all of these antibiotics. So this is probably a Staphylococcus aureus that has become MRSA because it's sensitive, resistant to all the antibiotics except for vancomycin. And then if we do it again, you come up to the same first plate we came to. Any question about how you use the um, the virtual lab? You will need to use the virtual lab for answering the question in the worksheet for this lab. All right. So let's go to the first question. Using standards required for the Kirby bar disk diffusion method, E. coli is prepared using a spread plate technique. Antibiotic discs are placed on the surface of the agar and incubated overnight at 35 degrees. We then come out and take a look at the zone of inhibition. And there you can see the zone of inhibition right there for ampicillin. And this is showing you the size of the diameter of the zone of inhibition. You'll note you don't read the caliper from here to there because the caliper is set 0 here, not there. So we don't read it from here to here. What we do is we read it from 0 to 0. So for ampicillin, the correct answer would be about 15 millimeters. And that's done in the table here. For ampicillin AM, the size of the zone of inhibition is 15. And you then look at the table up here. For ampicillin, let me scroll up just a bit. For E. coli, if we have 15 millimeters, it is intermediate. So the correct answer there would be I. So what you do for this question is fill in the table here for CF. This is CF here, measure the size of the zone of inhibition, put it in the table here, look up on the table, tell me if it's sensitive, S, I for intermediate, R for resistant. Fill in the table here. And that's the first question. Any question about any of that? All right. That's question 2, by the way. 2 right there. Question 3. List 5 variables that must be standardized when performing an antibiotic susceptibility test using the Kirby biodiffusion method. You can get the variables in the lab module. If you remember, we had a table listing more than 5, actually. And then further questions 4. The size of the zone of inhibition often varies for 2 different species of bacteria when challenged with the same antibiotic. What is a possible explanation for these differences? Stated there. 5. What would happen if we didn't use aseptic technique to put antibiotic disc on the plate? So state that there. And then mention what will happen to our test results. State that there. Let me check to make sure I've updated the worksheet for this lab to the newest version. I should have, but let's just check to make sure I did. Oh, there it is. I'm just going to download it because we can view it easier. Yep, it's there. All right. 5, what would happen? Oh, I already mentioned that one. 6, what would happen if we increase or decrease the concentration of the antibiotic in the disc? Be specific in your answer. And you need to explain what would happen if we increase the concentration, as well as what will happen if we decrease the concentration. 7, antibiotics can be bactericidal, they kill the microbe, or bacteriostatic, they inhibit microbial growth but do not kill the bacteria. When observing a zone of inhibition around a disc, how would you determine whether the antibiotic causing the zone was bactericidal or bacteriostatic? I'll warn you, this is a thinking question, and students often get this question wrong the first time, but most students do get it correct the second time the lab is graded. So this is a difficult question if you think and try to answer it. But like I said, most students will get it correct the second time it is graded. Any question about that? All right. 8, when performing the antibiotic sensitivity testing, it is important that the test conditions are kept very standardized, meaning we have the same kind of media, Mueller-Hinton, always the same agar depth, 4 millimeters, the same age of the culture, meaning a young culture. Why is that? Answer why. 9. Are there any other substances besides antibiotics we could evaluate using the method, which we're talking about the Kirby-Bayer diffusion method? And then name one. It's not stated name one, but at least give one substance you can use the Kirby-Bayer um, diffusion method besides antibiotics. Obviously, if you say penicillin G, it's not going to be correct. Besides antibiotics. Uh, 10. Does the presence of the zone of inhibition necessarily mean the bacteria being tested is sensitive to that antibiotic? Explain your answer. 11. From the size of the zone of inhibition of chloramphenicol on E. coli in the virtual lab, is the bacteria sensitive, intermediate, or resistant to the antibiotic? And then for chloramphenicol on P. aeruginosa, is the bacteria sensitive, intermediate, or resistant to the antibiotic? And give the answers here. All right, any question about this lab? If not, I will be here until 4 o'clock to answer any questions or until the last student logs out. Any questions? If not, go ahead and get started working on this lab.
I just kind of had a general question. If we wanted to make up points and we resubmit the lab, we are just resubmitting it where the original assignment is located, right?
Yeah, you submit it on top of your previous submission. Is that your question?
Yeah, okay.
Yeah, yeah.
Thank you.
All right. In case somebody else wants to hear your question. All right, what's your question?
So I have a couple. I'm sorry, I logged into lab late. Our infectious disease research project, we have not gone over that, correct?
Yeah, we did.
Oh, we did. Okay, sorry, I missed class last week. I've been trying to read it. We email you the one we want to focus on, correct?
Correct.
Okay, and then my next question is the unknown disease.
Yes,
When do we start that one?
we've already started it. I'll send you the results on Tuesday. You need to see last week's lab. That's when I
Okay,
talked about, not last week, last Tuesday's lab,
okay,
is when we talked about the unknown project.
okay. And
I
then
don't remember when we talked about the infectious disease, but you can look on the schedule of classes. It was early.
all right.
I
I think that was
I
week
think that was
one.
week 2.
Oh, week two, yeah. And so for the unknown, do you send us the one that we need to do? Or
No, you have to request wait a minute, the unknown project?
yes.
Yeah, I will
Yeah.
send you the bacteria you're working with.
Okay, perfect. Thank you so much for going over that.
Okay.